Have you ever met someone that's depressed or antisocial? If your answer is yes, you may have encountered someone with bipolar disorder. According to the American Sociological Association, 3% of Americans suffer from this disease. Today, I will provide information pertaining to bipolar disorder, signs and symptoms, medication, and how to cope with those that have this disorder. Bipolar disorder is a mental disorder that brings severe high and low moods and changes in sleep, energy, and thinking. Some signs and symptoms is anxiety, mania, and depression. Depression is the most common side effect, and it affects 1 out of 10 with this disease. Depression is sadness and loneliness. 50 signs of mental illness sometimes states that sometimes there is a lack of motivation. The second symptom is mania. According to James Hicks' book, mania is a term psychiatrists use to describe a state of elevated agitation. Mania sometimes causes people to have rapid speech and it's difficult for them to concentrate. New Hope for people with bipolar disorder states that people with mania lack insight, they deny anything's wrong, and angrily blame others for pointing out their illness. In the mania state, there are many reckless spending, gambling, and aggressive behavior. The last symptom is anxiety. According to APA, anxiety is an emotion characterized by feeling, worried thoughts, and physical changes such as blood pressure. People often experience shortness of breath, and exercise is a good mechanism that you can use to cope with this disease. For an example, yoga helps with concentration and relaxation. Now that I have discussed signs and symptoms, I will discuss the forms of treatments. Treatments are available for this disease. The first treatment is medication. Medication therapy is the most important treatment for an early onset. Some medications include lithium, Depakote, Risperdal, and Topamax. Medication helps stabilize patients with bipolar disorder. According to New Hope for people with bipolar disorder, approximately 80% of people have a positive response to lithium. The second form is psychotherapy. Psychiatrists can help people with bipolar to recognize and manage symptoms and through this treatment. Rhonda Five's book Bipolar 2 describes psychotherapy as a form of counseling to help cope with everyday life and the stressors. Because bipolar is a disorder, one must always take their medication because of recurrent relapse. It is imperative to keep doctor's appointments and comply with the treatments. Remember, there is help for this disease, and one can find support outside of medication and counseling. There are ways to cope with bipolar disorder. It is very important that family and friends educate themselves concerning this disorder. There are various resources that are available. One can get books and read information online. If you're aware of the signs and symptoms, then you can help the patient before they have an onset. It is important to keep medications current, find support groups, and different types of awareness. Knowing that you have a support group helps the patient with his or her self-esteem. Now I have discussed bipolar disorder, its signs and symptoms, treatments, and how to cope with patients with bipolar. It helps one better to understand that's affected by this disease. In conclusion, one can receive help. Bipolar can be dangerous if left untreated and undiagnosed. Treatments are available and there are ways to live a healthy life with bipolar disorder.